Hello friends, welcome to our NS YouTube channel. Today I am going to explain about congestive heart failure. If you are watching our video first time, please like, share and subscribe my channel. This video contains heart failure classifications, causes and risk factors of congestive heart failure, pathophysiology, clinical manifestations, diagnostic evaluations, medical management, surgical management and nursing management. Meaning of congestive heart failure. The names heart failure and congestive heart failure (CHF) does not mean that the heart has actually failed or stopped, but mean one or more chambers of the heart fail to keep up with the volume of blood flowing through them. CSF is a condition in which the heart's function as a pump is inadequate to deliver oxygen-rich blood to the body. CHF is a serious, progressive condition that is usually chronic and can be life-threatening. The term CHF is most commonly used when referring to right and left-sided heart failure. Heart failure classifications. New York Heart Association Heart Failure Symptom Classification. Acute vs chronic heart failure. Right-sided heart failure versus left-sided heart failure. Systolic heart failure versus diastolic heart failure. Low output vs high output heart failure. Causes and risk factors: coronary artery disease, high blood pressure, hypertension, previous heart attack, myocardial infarction, irregular heartbeat, arrhythmia, heart valve disease, especially of the aortic and mitral valve, congestive heart defect you are born with, cardiomyopathy, disease of the heart muscle, abnormal heart rhythm, arrhythmias, infection of the heart muscle, conduction defects, overweight, diabetes, smoke or who abuse alcohol or cocaine, large salt intake in diet, hemochromatosis. Okay, we'll next discuss about clinical manifestations of congestive heart failure. Left-sided heart failure contains of fatigue or shortness of breath, dyspnea, paroxysmal orthopnea, pulmonary edema, wheezing, pale or bluish skin, weakness, insomnia and restlessness. Right-sided heart failure contains of swollen legs, peripheral edema of lower extremities, liver and spleen enlargement, right upper abdominal pain, swollen and distant neck pain, fluid buildup in the stomach, nausea and vomiting, appetite of loss, weakness, fatigue, dizziness and fainting episodes, slow weight gain, irregular heart rhythm. Diagnostic evaluations: patient history, physical examination, electrocardiogram, echocardiogram, chest X-ray, exercise test, stress test, cardiac catheterization means angiogram, radionuclide, ventriculography, electrophysiology study, cardiac computerized test, magnetic means MRI, blood test or brain natriuretic peptide, medical management, diuretics, angiotensins 2, digitalis, beta blockers, aldosterone antagonists, vasodilator therapy. Surgical management: coronary angioplasty, coronary artery bypass surgery, implantable cardiac defibrillator, intra-aortic balloon pump, left ventricle assist device, valve repair or valve replacement surgery, heart transplantation, pacemaker insertion, cardiac therapy, nursing management. Often, history of symptoms, limits of activity, response to rest, and history of response to drug therapy. The nurse explores sleep disturbances, particularly sleep suddenly interrupted by shortness of breath. The nurse also asks about the number of pillows needed for sleep. The nurse helps patient to identify things that they have lost because of the diagnosis, their emotional response to that loss, and successful coping skills that they have used previously. Physical examination: auscultate heart for S3 heart sounds, a sign of heart failure. Assess the signs and symptoms of the pulmonary and systemic fluid overload. Assess peripheral arterial pulses, note quality character, assess heart rhythm rate and BP. Assess patients for presence of peripheral edema. Assess extremities for color and temperature. Obtain hemodynamic measurements as indicated and note change from baseline. Nursing diagnosis: decreased cardiac output related impaired contractility and increased preload and afterload. Impaired gas exchange related to alveolar edema due to elevated ventricular pressure. Fluid volume excess related to sodium and water retention. Activity intolerance related to insufficient oxygenation. Anxiety related to breathlessness and restlessness secondary to inadequate oxygenation. Okay friends, today we learned about congestive heart failure, meaning heart failure complications, causes and specters of congestive heart failure, pathophysiology and clinical manifestations, diagnostic evaluations, surgical management, nursing management and complications, and also medical management. Okay friends, how is it today video? If you like the video, please like the video and subscribe my channel and also follow my channel.